Welcome everyone. Welcome to Next Gen Therapies for Stills and SJIA Stills and MAS. Maybe I'll wait for that dinging to stop.
Yeah, I'm not sure we can change the setting right now. We're just checking how we can do this.
Somebody says you can turn off the into setting and turn off audio alert.
Yes, but since the meeting has started, I'm not too sure that would sync with the settings, but we're looking into this.
Okay, got it. So I'll continue. Welcome everyone. Let me make sure I can do my slides. Yeah, so just to begin, a few lines about the foundation. The foundation was founded in 2014 by my husband and myself after 2 years after our child got diagnosed with systemic JIA, and when he got diagnosed with the lung complication in systemic JIA. Our goal has always been to help find new treatments and ultimately a cure. And we do this via our events. Our events are a big part of what we are and how we do things. The Next Gen conference, it's really the first big thing that we did. And this is the picture from the first conference. And many of you who are here today will recognize yourself in these pictures, whether it's the physicians or, the regulators or the parents. And this is the goal. The goal is to have small focused conferences where you drive that goal forward. Unfortunately, now with COVID, we are doing this virtually, but this was the original vision. One thing to point out, in the last 2 years, we have been a grantee and a part of the Rare as One program, which has been a huge deal for us as working as part of other patient organizations, learning from them and kind of moving forward together. And it's really exciting to see what patient organizations can do nowadays. Talking about rare diseases, 28th Feb is a Rare Disease Day. There's a lot of people with rare diseases in this world. Everybody knows somebody with a rare disease. Go give them a hug. It's a time to think of how these rare diseases, so many which don't have a treatment. And we have in our community, we have our own rare artist. And this is Una Newman. She is 5 years old and she has SJIA and was actually recently diagnosed with interstitial lung disease. And this time she participated in the rare artist competition and she was one of the winners. And she made this art piece, which is Sarge, which is the bald eagle. And it's a rare bald eagle. So it's lovely to see that and to see our community being a part of the global rare disease community. And I try to begin every conference with a picture of who we are doing this for. And now we have also adult patients, so I cannot wait for the next physical conference where we can have all of them together. But this is our North Star. This is who we do this for. This is from one of our conferences where all the kids got together on the stage and we took their pictures, and it was a real, for those who were there in their room, it was a real to-do to get them all to sit down. But this is why we do all this. I'll go into unmet needs in SJIA and how we as the foundation think about it. Our thinking about SJIA is that it's a rare disease. It needs its own community driving things. It's what we've learned as part of the patient organization is that it's a complex systemic disease. It can attack the joints, it can attack the lungs, it can attack the brain. And for some patients, current drugs don't help. And this is what the unmet need is. This is what we are focused on. I think the research is starting to be really clear that adult stills in SJIA are the same disease, and we hope to be able part of the work of doing the work of bringing them together. Continued on, this is also something that we've thought so from the beginning, that there is the larger, that we focus in on the middle of that circle, the smallest one, who have often, these are the refractory kids who don't have arthritis, don't fit the typical definition of SJIA. And some of them have lung disease. Some of them now we are finding more and more with liver disease, and it's a similar phenotype. And the question always has been is that, is this truly SJIA or is this a different disease? And if you think about SJIA itself, it's a rare disease, but a larger rare disease with a diagnosis by exclusion, meaning, as many of the researchers will point out, it's, there could be multiple subsets in it. Also, SJIA is in the context of being an autoinflammatory disease. And there's many rare autoinflammatory diseases constantly being identified. They share medications, they share symptoms, but they're still distinct. And new diseases are coming up, and some new diseases with high IL-18, like we have in this atypical SJIA subset, are coming up. So in our minds has been this question, and we constantly see it in researchers when we talk to, is this a new disease or is this part of SJIA? And this is what this conference is about. Now, I'm going to go over this pretty complex table, but stay with me. It's important to actually understand this because this forms the kind of the goal of this conference. This is the landscape analysis that we did about 2 months ago as we started planning this conference. And it shows we looked at, and Luciana helped me with this, we looked at every clinical trial in SJIA ever done in US and Europe. And if you start with the different groups which are overlapping, they're not separate. If you look at the new onset early SJIA group, there's a bunch of drugs that's been tested in them and they continue to be tested. Similarly, if you have refractory SJIA with mostly arthritis, you can qualify for the same trials. And typically those patients have been part of those trials. Now, if you come to group 3, which is refractory SJIA without arthritis, typically with high IL-18, well, because you don't have arthritis, you cannot qualify for any of these trials. So historically, none of these drugs were tested on this subset of patients. It's not just right now, it also goes into the past. To the best that we could understand, that's what we found in our analysis. Similarly, with refractory SJIA with lung liver disease, often they don't have arthritis, sometimes they do. So these zeros are what we hope to change. Now, if you go to group 5, there's this emerging, set of IL-18, high IL-18 diseases, and we're starting to see some clinical trials in those diseases because they're small, they're well-defined. And it's worth we keep an eye on that group because maybe that's a part of the group that we should try to do trials in. Group 6 is adult onset Still's disease because SJIA is, after all, the same as Still's. And the adult onset Still's disease, the criteria do not require arthritis, meaning that those patients can be in trials. And finally, we have MAS, which is important to look at, but not necessarily what we're talking about here. So after doing this analysis, we really started talking to researchers, started showing this, trying to understand. And this conference is really delving deep into this question. How do we make sure that we have, now that there are some drugs in the pipeline that can help this group, how do we make sure that we actually have clinical trials in this group and we try to identify the right drug? And in trying to follow this simple question, it's really not so simple. There's a lot of complexity in it, and that's what we'll analyze in the next 3 days. I want to just thank everyone who has done so much work behind the scenes to make this day happen. Luciana, Anna, who's always helping in any of these things the foundation does, Leah and Kari, who are always there, Zuli, who's I turn to all the time, and Vince, who's not part of the foundation formally, but has helped us a lot in thinking through things. And among the physicians, Alexi, who I turn to for every question about the foundation, Scott, who's a big part of our strategy, Fabricio, Grant, Bas, Hermina, Dan, Peter, Yuki, thank you all for giving us so much of your time to think things through and to come to this day. We are really grateful. I'm going to quickly walk over the plans for today. And I think I'm already running a bit late. So the plan for today is to start off with some patient panels, then come to Alexi's talk on distinctive clinical phenotypes, move on to a session about diagnostic criteria, which should be interesting, and then IL-18 clinical trials. Later in the day, after the morning break, we will have a focus session on stem cell transplantation in US and Europe recent cases. And with that, I think I'm done with my morning slides. Before we go into the patient panel, I want to just do a little bit of housekeeping in terms of, if you are in the MCI Events Air app, we highly recommend that you go to the bottom of the screen here where it says Enhanced Experience, and you launch Zoom, because the way we'll run the conference, you really want to be in the Zoom full window. Ideally, you stay in the speaker view, and you can change that at the top right. When we have panels, it might be better to be in the gallery view. Stay muted, but you're welcome to chat and to ask relevant questions. If you click on the chat at the bottom of your screen, it'll pop the chat panel out. So we really recommend staying in the full screen experience with the chat window open to get the full benefit of the conference. If you need help, then you can private chat with help desk, and you'll see a name after that, or you can email our team. We have closed captioning. We're going to see how that works. On the bottom of your screen, you can see there's a button called Live Transcript if you want to use that. So with that, I am done with my housekeeping slides. Now on to the session. And we'll start with Kari, and I'll stop sharing my screen. So Kari, can you just quickly describe your child's case?
Sure. Good morning, everyone. Hello, my name is Kari Cupp. I'm mom to Reagan. She has SJIA with CNS involvement. She recently turned 18 years old, but became ill at age 1. Onset was like most: fevers, rash, swollen joints, and large spleen and swollen lymph nodes. She has had 3 bouts of subclinical MAS, but IL-18 has never been high. However, we see noticeable changes in her S100 protein labs when she is not well. While her illness has proven to be very difficult to manage, she is currently shunted, and we have good control by stacking medications. She's currently using high-dose Kineret, Alaris, methotrexate, and Celebrex. She is under the care of Dr. Grom at Cincinnati Children's, and to date, I've been able to locate 5 patients just like her with CNS involvement in the US and Canada, but she is currently the youngest. Being a part of the SJIA community for so many years has given me a bird's eye view at how different this illness can be from one child to another. It's certainly not a one-size-fits-all process. While the onset stories typically seem somewhat similar, the path it takes appear to vary drastically from child to child. We certainly see a range of disease impact, varying involvement from persistent arthritis, no arthritis, CNS involvement, liver, kidney, lung, persistent MAS, etc. We also see symptoms that seem to arise at similar ages, like gastrointestinal problems, dental issues, and stunting in growth from the need for excessive steroid use. If there was ever an illness that would benefit from personalized medicine, SJIA is certainly it. I hope over the next 3 days we can form a plan to truly meet the unmet needs in refractory SJIA.
Thanks. Laura, can you go next?
Hi, this is a little bit terrifying for me. It's 7 in the morning, but my name is Laura. I'm actually an adult patient. I was diagnosed at 34. I got symptoms weeks after my 4th pregnancy. And I was diagnosed 4 months later. I did have some symptoms during pregnancy as well. I'm considered a refractory patient. Biologics just slowly tend to stop working for me. And I haven't been on steroids more than a few weeks for the past 4 years. Sometimes I can get pretty low, but I can never get off of them. I have been on Humira, Kevzara, Kineret, methotrexate. I'm currently pretty stable on Alaris, tacrolimus, and prednisone. I only had arthritis at my initial presentation. Currently, if I flare, it's usually just systemic symptoms, but that could be because we're attacking the flares more sooner than we used to. I have not had IL-18 testing. And last year I was diagnosed with interstitial lung disease, as well as pulmonary artery hypertension. Both of those are pretty mild. The lung disease has been stable this past year, so I'm not on any treatment for that. And I started dual oral therapy for the PAH in November. My right heart cath, my pressure was 35, so not crazy high, but definitely there. And I did have, I'm really grateful to have discovered these complications. And it's basically because of this conference 2 years ago that I knew to be on the watch and to press for a diagnosis. I'm happy that everything's mild, but of course I'm worried for the future. Thank you.
Thanks. Ronny?
Good morning, everyone. My daughter Sam was diagnosed with SJIA at Boston Children's at 20 months old in July of 2020. She was initially treated with steroids and anakinra and later added methotrexate. She was stable and weaning for several months and began to flare again in December of 2020, so just several months after diagnosis. In that time, she appeared to show some allergic type reactions to the anakinra and was then changed to Ilaris, which didn't prove effective for treating her flare. In that time frame, she developed a cough and had a chest CT, which showed some abnormalities consistent with ILD. She continued to flare, changed to Tacro. She was admitted in April, flaring, changed to Xeljanz, and eventually treated with a series of 6 Gamifant infusions and discharged after 2 months of a stay. She was discharged on a ruxolitinib, cyclosporin, and steroid. She is unfortunately still not controlled and is currently flaring. She has consistently elevated IL-18 even when all of her inflammation markers are perfectly normal. She has tested positive for HLA. She has abnormal chest CT, mild clubbing in her fingers, but no other lung symptoms associated with her ILD. She is systemic only. She has no arthritis, thankfully yet. And her LDH remains high, like her IL-18, even when everything else is completely in control.
Thanks, Ronny. Robyn?
Hi, good morning. My daughter Madison was initially diagnosed with secondary HLH in March of 2020, and she started the 2004 protocol. And during her treatment, a lot of her symptoms started to come back. And that is when we got our SJIA diagnosis when she was almost 2 years old. We immediately started on Actemra infusions. She did have a reaction to that, so we had to stop and go to Ilaris injections. She was not able to be controlled by that alone. She had a major flare that ended her in the hospital. From there, we ended up on Xeljanz. She's completely steroid dependent. None of these drugs have been able to control her on their own. Last summer of 2021, she started to develop a dry cough, and her rheumatologist at the time ordered a chest x-ray, which came back abnormal. And I'm here in San Antonio, Texas, so there's only one pediatric rheumatologist who does not know anything about ILD. So once he ordered a CT scan on her lungs, we then transitioned over our care to Texas Children's Hospital in Houston, and we got a new rheumatologist, and we saw a pulmonologist where we got our confirmed diagnosis of ILD. And that is when we started checking her IL-18 levels. I had never heard of that lab before until we got to more specialized care, and her IL-18 levels continued to stay high. Her first time she ever had it done when she was clinically well, it was around 8,000. And from there, it has gone up to over 121,000 when she flared. It has come down. When she flared, we did add Ilaris back to her treatment along with Xeljanz, and she's still on steroids. And just recently, she's clinically doing well. All her labs are stable, her inflammation markers, and it has jumped back up to almost 46,000, and we are not sure why. Her pulmonologist did start her on an inhaler for her ILD, and we are hoping that maybe it's inflammation in the lungs causing this, and we will recheck it at the end of the month. So for now, we are just monitoring the ILD progression as well as the IL-18 levels.
Thanks, Robyn. Since we are already a little bit over time, I will immediately turn it over to Dr. Alexi Graham from Cincinnati Children's, who's going to talk about the distinct clinical phenotypes in SJIA.